All right, so in chapter 3, we're going to cover diagnosis and assessment, which are two very important topics within abnormal psychology. Now, to do that, there's a whole list of things we need to cover. We are going to start off with reliability and validity, which is going to be the main focus of this video. And then the rest of the chapter, we're going to cover things such as diagnosis, psychological assessment, neurobiological assessment, and cultural and ethnic diversity assessment. So in order to talk about reliability and validity and just diagnosis in general, we need to first define some things, right? So diagnosis is something you're probably already familiar with the definition of it. And that's because I, I'm assuming that every single one of you has gone into a medical doctor and they have diagnosed you as having something like you have strep throat or you have a broken ankle or whatever the case may be. The way the diagnosis is done is that there's a certain there are standards or ideas that are agreed upon by the scientific community. So doctors have an agreed upon definition of what strep throat is, right? So you're not going to go into one doctor with a broken ankle and they're not going to and they're going to call it strep throat, and you're going to go into another doctor and they're going to call it a broken ankle. They all have the same idea. And having that uniformity is actually really important within the field. And we'll talk about that a little bit more in just a moment. But so diagnosis is agreed on definitions and classification of disorders based on the symptoms and the signs. So the bone's cracked, it's a break, right? With mental health and psychological disorders, they're set upon ideas that we look at. And if a person meets those ideas, then we start talking about them having a specific psychological disorder. If they don't, then they don't have that psychological disorder. So you can have features of depression or features of anxiety, but it doesn't mean you have that disorder. There's certain things that I get anxious about. It doesn't mean I have a specific anxiety disorder, unless perhaps you went to snakes, and then I might have a specific phobia of snakes. I really hate snakes. But I don't qualify for the disorder. We'll talk about it when we get to that chapter. But anyway, we look and we can have some features of something. Just like you can have features of an illness, like you could have features of a cold, your nose is running, and that can be a symptom of a cold, but it could just be allergies, and you don't actually have a cold. Similarly, with mental health and psychological disorders, when we have symptoms of something, we might have that disorder, but we might just have some symptoms of it, like you might have a runny nose, but not actually have a cold, right? So when we talk about diagnosis, this process is really important for a couple reasons. One of the first reasons is it's necessary in order to get good treatment. So throughout the field of psychology and therapy, there's been tons and tons of research done. So we know certain treatments are really effective. For example, dialectic behavior therapy. Awesome therapy, huge book. Awesome therapeutic approach. I really like this therapeutic approach. Lots of research says it's really, really good, but you need to know what type of person to apply it to. And so when I know someone's diagnosis, sometimes this might be the right therapeutic approach. Other times, I might want to use acceptance and commitment therapy, or parent-child interaction therapy, or mindfulness training, or cognitive behavioral therapy, or so many other things, right? It's just like going into a medical doctor. You wouldn't want someone to give you an antibiotic if you had a broken arm, right? That's not the right treatment. You gash your arm, you probably want stitches and not a CAT scan, right? So anyway, we want to do the diagnosis is exceptionally important. It helps us give good care and the right care. The second reason it's really important is that lets professionals communicate with each other. Uh, so we can get advice from other professionals and consultation from other professionals. And we can write books like I just showed you and communicate with each other. And then those diagnoses are also the foundation of good research. So when we have people well diagnosed, we can do good research on how to treat them and what's going on in their lives so we can understand the etiology of disorders. But if we don't have things accurately diagnosed and defined, we can't do those things. So diagnosis is exceptionally important, and there are a lot of advantages to it. Now, unfortunately, there can also be a lot of disadvantages to diagnosis, like prejudice and stereotype and self-fulfilling prophecies and all those negative things that can come when we believe something is not right with us, right? So sometimes people let their disorders define them instead of letting them define themselves, and the disorder just being a part of them that they're dealing with. Okay, but diagnosis is exceptionally important. Another big advantage of diagnosis is that when someone has a diagnosis, it frequently opens up resources to them. So for example, insurance doesn't like to pay for just random therapy, but if they're paying for therapy for borderline personality disorder, they're much more likely to pay for that treatment than just, I want to talk to a therapist. So it can open up access to services. Okay, so whenever we talk about diagnosing something, we want a measure that is both reliable and valid. Now, a lot of people use these terms interchangeably colloquially. So in a day-to-day language, they use these terms interchangeably, but they're not interchangeable. They actually mean very different things. So let's define reliability and validity really quick before we dive into the nitty-gritty of these terms. So reliability means that when you use the measure the same way with people, you get the same results over and over again. Okay, so it gives you the similar or the same results again and again and again. It's reliable, right? So I really like one textbook I used to use that's way back that described reliability with a target, right? And a reliable shot doesn't mean that you're necessarily hitting the center of the target and hitting the bullseye. A reliable shot means you're hitting the same spot. So you might be hitting way off the bullseye, but you hit it every time. That is reliable. So for example, let's see. I think I have a tape measure in here. Huh. I have this one. I forgot about this one. Anyway, so here's a tape measure. Let's say I want to use this to diagnose people, okay? And I'm going to diagnose you to see if you have depression or not. So I take my handy dandy tape measure and I wrap it around your wrist at the skinniest part of your wrist, right? And I do that for everyone in the class. And if you have a wrist size that is less than 6 inches, I'm going to say that you're clinically depressed, right? And if your wrist size is more than 6 inches, I'm going to say you do not have depression. That's my measure of depression. Now, this is why terms are so important. Is it a reliable measure? If I trained you how to use this tape measure and I train people how to do this and they use it the same way every time, how reliable would it be? And the answer is, it is super reliable. It is an exceptionally reliable measure of depression. It's really, really good being a reliable measure, meaning it gives you the same answer every single time when used the same way. If you use this tape measure the same way, and you're trained on how to use this tape measure, and you assess people the same way, you're going to get the same answer over and over again. It's going to have really, really high reliability. Now that brings us to our second concept, is validity. Does it measure what I'm trying to measure? Does it actually measure your depression? And the answer is clearly no. Wrist size does not measure depression. So when we're looking to assess something so we can accurately diagnose it, we need assessments that are both reliable, give you the same answer over and over again, and valid. They measure what they're supposed to measure. So this is a reliable measure of wrist size, but it is not a valid measure of depression. It's a valid measure of bone structure, right? Anyway, so hopefully that helps you understand the difference between reliability and validity. Now, when we look at measures of reliability, they're usually on a scale from 0 to 1. 1 means you get the same answer every single time. 0 means there's no relationship between answers between two different answers. Obviously, the higher the number in reliability, the better the measure, right? So if I'm using this to measure bone structure and I get the measurement of my wrist being 6.5 inches, which is what I did actually get, 6.5 inches, and then I measure it again and I get 6.5 inches, and I measure it again and I get 6 and almost a half, and then 6 and just over a half, and I'm getting really close to 6.5 every time I measure. It's reliable. And because I'm getting those same measures over and over, if I was using a measure of reliability and I was to say how reliable is this for measuring that, it would be close to 1. Higher scores mean it's more reliable. Now, if I was using something else and one time I get a measurement of 6 inches, and the next time I get a measurement of 10 inches, and then I get a measurement of 4 inches, which obviously would be completely off, then it would have a much lower number, closer to 0, indicating that it's not reliable. Now, when we talk about reliability, we can sub-separate it into specific subtypes of reliability. The first one on here is inter-rater reliability. Inter-rater reliability is that we have different people rating different things when it comes to assessment and diagnosis. So let's say, go back to the tape measure example. I'm going to use it a lot today. Sorry, but it's a good example. If I train 5 different people, or two, let's just go with 2 for now, 2 different people to use this tape measure, and they're measuring wrists, and they're getting very similar sizes, that would be the idea of inter-rater reliability. I have 2 raters, they're measuring the same thing, and they're getting very similar answers. And that's really important for research. So if I'm studying something, like I did a research study where we were looking at how newspapers were portraying religion, and if they're portraying religion in positive or negative ways. And we had these very set criterion for how to assess a newspaper article to determine how it was talking about religion. And I had 2 researchers, at least 2 research assistants, categorize every single newspaper article. It was a huge project. And what I want to see is if they were rating the articles in the same fashion, which they were, at a kappa level of 0.97, which 0.97 means, were they perfect? No. Were they close to perfect? They were dang close to perfect. They were rating these articles like pros. Anyway, I was really proud of my research assistants. That is a measure of inter-rater reliability. Test-retest reliability is when you give the same person the same measure twice. So I could give you an IQ test, and then I could come back and give you another IQ test and see if you get similar results. The problem with test-retest is there can be some practice effects. So when people take a test more than once, they practice so they can become better at things. But also people do shift somewhat over time, right? So if I give you a measure of your current mood state, maybe you're really happy today, and then I give you a measure of mood state tomorrow, and maybe tomorrow you're having a crappy day, and I should get a different mood for you. So not all measures will stay consistent, but some things should stay consistent, and they should stay consistent over a period of time. And so if I gave you the same test of depression today, and then I give you a measure of depression 4 days from now, since depression is a more enduring experience, not mood, we're not talking about a sad mood, we're talking about actual clinical depression, and because it tends to be more enduring, you should have similar results 3 days from now. So if I give you the same test more than once, how much do those tests go together? And that's the concept of test-retest reliability. We also have what's called alternate forms reliability. Now, sometimes it's important to give people the same measure more than once. And if I gave you the exact same test more than once, you can have things like practice effects because you've practiced it, right? But let's say a teacher wants to give their student math tests to assess their math ability. What could they give? Very similar types of questions with just different questions on them, but they're assessing the same thing. So that would be the idea of alternate forms. I'm assessing the same thing, but I have 2 different forms of it, so I can use it with the same person more than once. And it's not, so comparing how those 2 forms work is establishing alternate forms reliability. Now, the last type of reliability is internal consistency, right? So with these other ones, the test, retest, alternate forms, inter-rater, usually you're going to get really high ones. Internal consistency tends to be a little bit lower on reliability, but still really important. And that's because what inter-rater internal consistency is doing is it's asking, it's looking, do the questions inside of a measure go together? So if I have an assessment measure on depression, and let's say it has 10 questions. If I give someone with depression those 10 questions, do the answers to those 10 questions go together? Do people answer them in similar ways? If they're all questions assessing depression, the answers should somewhat go together. Now, does that mean that they're going to go perfectly together? No. because you're not going to rate how sleep disturbance necessarily the same as eating disturbance, because some people with depression have more disturbance in their sleeping and others have more disturbance in their eating. They're not necessarily going to be a perfect match, but we do want to see that they do hang together, especially across people, and that's numbers of internal consistency. So those are some of the big measures of reliability. Okay, sorry. So I just got ahead of myself and just talked about them all on this one slide. I do have more slides on each of them, but we've already covered them. So inter-rater, test retest, alternate forms, and internal consistency. Okay, so that's going to bring us to our ideas of validity. Whether a measure measures what it's supposed to measure. That's a nice way of saying what validity is. Uh, Does a hostility questionnaire actually assess hostility? Does a depression questionnaire actually assess depression? Better than my tape measure, right? Uh, anyway, so in order for a measure to be valid, it has to be reliable. However, a measure can be reliable and not valid. So let me help you think about this in terms of a target, right? Let's say a valid shot with a target is one that hits the bullseye. It's what we want to hit, right? That's valid. A reliable and valid shot is repeatedly hitting the bullseye or really, really close to it. Think of it like a dartboard. You're hitting that 50 point or 25 point, the right two center circles over and over again. That's highly reliable and valid. Now let's go to something that's highly reliable but not valid. So you could be hitting clear out off the board. My son sometimes says that. We have a dartboard set up in our garage, and sometimes he misses the board completely. And let's say someone's missing the board completely and they're hitting the same spot but missing the board completely. That would be highly reliable. They're hitting the same spot, but is it valid? Is it what it's supposed to be hitting? No, you're supposed to be hitting that bullseye. So it's highly reliable but not valid. Now let's talk about something that's not reliable. Once you hit the bullseye, but once you hit off the board, and once you hit over here, and once you hit over there, and you're hitting all over the place, you're not reliable. Can that measure ever be a valid measure? Well, you're like, well, you can hit the bullseye once. That's not what we mean by valid. We mean it works the way it's supposed to work, not by a fluke, but it does it repeatedly and over again. It measures what it's supposed to measure, and it's hitting that bullseye over and over again. So if it's scattered, low reliability, it can never have high validity. But once we know it has high reliability, then we can talk about it having validity. Is it hitting what it's supposed to hit, right? So unreliable measures will not have good validity. An unreliable measure does not yield consistent results, therefore it will not relate very strongly to other measures. Okay, so validity. Reliability does not guarantee validity. We already talked about that. My son hitting clear off the board. Even if he hits the same spot off the board over and over again, it's not a valid shot. It's not measuring what it's supposed to measure. Just like this tape measure had really high reliability for measuring risks, but if I'm using that as a measure of depression, it's not valid, right? Okay, I've hit those terms enough. You're probably going, come on, Dr. Butler, we get it. Students tend to struggle with this, so I'm sorry I hit it a lot. Let's keep going. So let's talk about different forms of validity. Now, there are more than your book covers, and it's fun to go into those, but I'm going to restrain myself and just hit these main ones. So the first one is content. Whether a measure adequately samples the domain of interest. So let's say I am assessing depression. And so I have a questionnaire that's just about sleep. That measure would have poor content validity because the idea of depression is much broader than just sleep disturbance. So would those questions be good questions to have in a questionnaire for depression? Yes, sleep disturbance can be part of depression. However, is it sufficient? Does it measure all aspects, all the content that we should with depression? No, we need to assess mood and suicidality and eating disturbances and disturbances in daily routine and all these other aspects of depression. So it would have poor content validity. So whether a measure adequately samples the full domain of interest is the idea of content validity. Content validity is a subpart of construct validity. Construct validity is an even bigger idea. So content validity, going back, does it measure the bases that it should measure? Does it get all those ideas? But construct validity is a little more amorphous and harder for students to understand, but it's really important. So does it work the way it should work? So if I give a measure on depression, does it assess depression, but does it predict everything it should go with? Does it predict how people act in the future? Does it predict how they've acted in the past? Does it predict what treatments? Does it work the way it should work? This is a bigger idea than content validity because something can cover the right content, but it might not actually predict future behavior. It might not predict current behavior. People can lie on measures, different things can go on. So even though it might have the right content in it, or people might not understand what they're being asked or how the measure is supposed to work, does it get at everything it's supposed to? So if it gets at everything it's supposed to, construct validity is like the overarching idea of validity, that we have something that's assessing things the way we want it to. So a construct is an inferred attribute. So we have to, I guess that helps. So it's this idea of how things are. So it's this inferred idea. Involves correlating multiple measures of the attribute, showing that self-report measure is related to other measures. So the person fills out the questionnaire, and does that measure what the doctor's seeing, and does that measure what the parents coincide with what the parents seeing, and does it go and coincide with what happens in the future, and all these different things. And the more that we can say yes to that, the more we can say something has construct validity. Construct validity is exceptionally difficult to establish, and since it's difficult to establish, very few things talk about having high construct validity. Most of them focus on having good content validity and different forms of reliability. Okay, so that brings me to activity 1 that you can do for this chapter, which is you can go find a scholarly article, so something from a research journal, right, that includes information about the reliability and validity of a psychological measure. Now, if they don't talk about validity, that's okay, but it has to at least talk about reliability of the measure. And then you're going to give the reference in APA format and explain what you found out about the reliability or the validity of that measure. So you can find a measure and say, based on what the researcher said, this measure had good internal consistency, which is a type of reliability, meaning the questions in this questionnaire go together the way they're supposed to. That's what you could do, right? And then tell me what the measure is and give me the APA reference. All right, that's video 1 on reliability and validity. Let me know if you have any questions, and I'll see you in the next video.